Good morning and welcome to Central University Television, broadcast live from our studios here at 1 Silicon Hills, Mile 91, Tonkolele District. I am James Samuel Tholley, and today we are being joined by beautiful and of course a handsome guest. They are members of the HAPES Healthcare Foundation here in Sierra Leone. We will be discussing, among other things, the health sector here in our country, and of course they are here today at Central University to deliver public lecture and many other events they will be organizing in Mile 91 community. But before that, let's get their names and of course let's get to know what they're here for. Can you tell us your name and of course who are you?
Thank you very much. Good morning, viewers. I am Esther Te, and I work with AIDS Healthcare Foundation, AHF Sierra Leone, and I am the Prevention and Advocacy Manager. It's a pleasure to be here and to talk to the people of Sierra Leone.
Good morning, good morning, good morning, people. I am Amara S. Levy. I work with the National HIV Secretariat, the institution charged with managing the response of HIV across the country, working with partners. I am the Human Rights Technical Lead.
So, can you give us an overview of your organization?
The National HIV Secretariat was established by an Act of Parliament in 2002 to respond to the global pandemic we had with HIV and AIDS. And this was a requirement by the UN for countries to set up systems to be able to manage. And we received an Act of Parliament that was adopted in 2007 and also reviewed in 2011 Act, which gives a mandate in coordinating the response of HIV. So it means that it addresses HIV from the point of view biomedical and non-biomedical, meaning that it's not just treatment, we are looking at accessing the service. We talk about issues of rights and opportunities for the service users, the involvement of communities, working with different groups of communities, societies, CSOs, and even the people themselves. And also it looks at opportunity of how government looks at setting up systems to be able to close the gap together with development partners. So this is what the response is about. So it's guided by what we call the National Strategic Plan that is developed every 5 years to be able to look at where the country directions are focused on. The current NSP that is ending focuses on 3 priorities. One is to look at prevention, the other one is to focus on treatment, and the third one is to look at enabling environment. And why is the focus on the 3? One is to look at to reduce new infection. You know, if we don't close the tap, it means that more people will be infected. And that is what we're working on together with partners. The second one is to also to reduce AIDS-related death. You know, the interesting thing about HIV and AIDS, you don't die of HIV, you only die of AIDS. It means that you get infected and it's unattended to and it progresses to the point of AIDS, so you're likely to die of AIDS. So this is to provide services that will help to reduce people dying of AIDS. It means that if you're on treatment, you don't get to die of AIDS. So that is one of the responsibilities we're looking at. And the third one is to break the barriers, you know, enabling the people to be able to use the services, educating the public users, educating the communities, people knowing their rights and their responsibilities, and also to be able to connect in these issues to address issues of violations. And so this is the big journey we're doing, and I'm sure during the course of the discussion there will be a lot of things we'll share. Thank you.
So among the universities, why Central University?
Okay, thank you very much for asking. One thing that is important, just like my colleague Amara was saying, fighting HIV and other STIs, or in general sexual and reproductive health interventions, require a multi-sectorial intervention. So what we're doing is not to only limit interventions to the Freetown or in one location. We are being driven by data. Whatever we do is the data that speaks. So in terms of why we are here today at Central University, I would say it's part of expanding the reach of the work that is happening internationally. We can't only target big universities in Freetown and they're essential. and we look at the role that universities play, the universities carry sexually active young people. People who are well informed, people who are in the age where they want to explore. And we now see that we still have new infections, especially HIV. So being here in Central is a way of working together and seeing how, as part of the celebrations and interventions going on in relation to condoms and STI, we don't only target the general population, but the people who we believe can be ambassadors of sharing the information, of having the sexual contact, are also engaged in what we do. That is why as AIDS Healthcare Foundation, what we do is to complement the work of government to see that in any area where there is a need for expanded services for HIV treatment, prevention, care and support services, we are there to complement that effort. So you see that this is a very good mix. And I can tell you that there are so many other partners in line with what we're doing today. So aside Central, our doors are open to more and more universities as a way of partnership and continuing work that we plan to do.
Yeah, I have an understanding about HIV. They said it's not curable. So how to is that?
You know, repeat that.
Okay, HIV is not curable, but it's preventable. And it's also treatable. Basically, what that means is that once you're infected with HIV, there is no current drug that is available to say you'll be cured completely. There's still research going on. But there are drugs that are now available that will ensure that you're able to live a normal life as long as you have them on you. What does that basically mean? It means that you need to get tested to know your status. And once they discover that you have HIV, you'll be initiated on treatment. It will be the same like somebody that had pressure, somebody that had diabetic, somebody that had cancer, somebody that has malaria, somebody that has TB. So it means that you're living your life on routine drugs. Once you have them, the interesting thing that happens is what we call, you become virally suppressed. Meaning that you will no more have the ability to transmit the disease to anybody, you live a healthy, normal life. So this is one of the reasons why this discussion is important, to let people understand that yes, HIV is not curable, it's treatable, and you can live a normal, healthy life.
So for people in dilapidated conditions that are not too financially strong to do tests in hospitals, not more finance, so what can they do, especially those in the villages? What can they do to be checking up on their health status?
Yeah, I think that's more or less in terms of access to HIV testing. I think it's very important for us to state it that HIV testing is free. Anywhere you go for HIV testing, especially within the government setting, HIV testing is free. So you're not supposed to have issues of payment when it comes to HIV testing. And the testing comes with quality services, it comes with counseling, it comes with consent, comes with correct results and connection to care. Because the role is not only for you to be tested, but connecting you to care. And just like my colleague was saying, when you have HIV, what actually happens is that there is replication. The virus in your system replicates. And without treatment, gradually, every virus that replicates affects the body's immune system, the cells, the CD4 cells, and these are the cells that help us fight infections. So if you are not on treatment, the continuous replication of the virus continuously also affects the cells that help you fight infections. So gradually you realize that the body lacks the ability to fight infections in the system. But with treatment, as you were saying, the drugs help to suppress the activity of the virus, puts them in a flight mode, I can say that, yeah, makes them become inactive in your system. And by that, the chances of transmission to another person reduces. So we now have individuals, pregnant women, who they're living with HIV, but their babies are HIV negative. Their sexual contacts are HIV negative because they have reached to a stage of a virally undetected stage where the virus has been, I would say, amputated, weakened to a stage where it is not active to transfer. So please note that it is very good for you to test, because testing is part of the overall prevention strategies that we are pushing, and testing is free. Don't pay for that.
I think just to add a little bit to that is the fact that we need to encourage ourselves as Virginia for the culture of seeking the services of healthcare. Just doing general checks. I think that's one of the gaps that we don't do until people get to a stage where they are acutely sick. So if you do general checks, you're able to manage a lot of these things we're talking about. It's not just HIV we're talking about. We're talking about your malaria, we're talking about TB, we're talking about sexual reproductive health infections that we will talk about, what we call STS. You need to do your general checks. Even your eyes, you need a general check. So don't see the healthcare facility as the only place for treatment. We need to look at it as more of a preventive and supportive structure for the community.
One key way of transmitting HIV is through sexual intercourse, whereas people get to meet. So what are preventives that you think people should involve in not getting HIV?
I think it's very important that you mention this, and these are some of the things that we want young people in particular to know about. I totally agree with you that HIV can be transmitted through unprotected sex with somebody that is HIV positive. Whether it's through anal sex, vaginal sex, oral sex, sex, as long as it is unprotected, there's a high chance of transmission. But there are other ways of transmission as well, which we need to talk about before we come to prevention. Like I mentioned, pregnant women can transmit the virus to the babies either through pregnancy, through labor delivery, or through breastfeeding, because the virus has a tendency to live inside the breast milk. There are other ways in terms of exposure to unsafe sharps. We have people injecting drugs. That exposure to that sharp that is contaminated already with HIV blood being transmitted to another person, that's also another way of transmission. And in instances where there are unsafe blood transfusion, like in hospitals, I know that a lot of regulations have been put in place, but we can't depict the fact that that is a way that HIV is transmitted. So if that blood is not screened well, there's a chance for transmission to occur. But it's in terms of the prevention, if we know already that unprotected sex can lead to HIV, then the best thing to do is to have protected sex. And one of the key ways is to use condom. I don't know if you can see this, just use it. I think it's a big message that we are sending out today. That condoms do not only have one beneficial role, aside preventing you from HIV, condoms can also prevent you from other STIs. We have gonorrhea, syphilis, and the rest. Condoms can prevent you against other STIs and pregnancies that are unintended or unwanted at a time. So it's more or less, instead of dual role, they play like more than two roles, in fact, because other STIs are a majority of the components. So that is one of the key prevention measures that we are sending out. But in addition, testing. We are using testing as a doorway to awareness raising. A lot of people tend to understand about HIV, but when you talk to them to go and test, they say no. And the reason is because they don't have the right information that will motivate them to test. You understand? So please, HIV testing is one of the key prevention methods. It's about medical intervention because it has to do with most of the medical things that we will use. But testing is very important for us. And recently there have been so many improvements that we want the people of Sierra Leone and young people to know. That under the biomedical interventions, we now have drugs that you can take both before exposure to the virus and even after exposure to the virus that will help reduce the transmission rate. One is the pre-exposure prophylaxis. It can be injectable, it can be tablet that you can take. Let's say, for example, you are HIV positive and your partner is negative. That negative partner can actually take the pre-exposure prophylaxis and the chances of transmission will reduce. People with multiple sexual partners, people whose activities put them at a higher risk of HIV transmission can also be on PrEP. That is even before the exposure. Once we have the PEP, post-exposure prophylaxis, it's also a medication that you can take there's a certain number of days, around 28 days that you can take, that even after you've already been exposed, within 72 hours, you can start that medication and the chances of HIV transmission will reduce. So it's more or less people getting the information that they require so that we all together fight HIV from the, fight new infections by 2030. In terms of pregnant women, we encourage facility deliveries. We encourage women to go for ANCs because we know that there's a standardized practice that if you're pregnant and you go for ANC, you will be tested. And when you are tested early, there's a way that they will counsel you, be on medication, help to suppress that virus so that the baby will not be at a higher risk of getting HIV at the end of the day. People who use sharps, we encourage that don't reuse those sharps so that we reduce the exposure to the infection. People who donate blood, we encourage that this blood should be screened very well so that we reduce the transmission rate. So there's a lot that we have to do. Even when we talk about the prevention methods, you notice that it's not one size fits all. So every one of us has a role to play in educating our peers, providing the access to the services, which is why now we are expanding service provision. Let people get tested, let people get information so that we are all on the same page. And there's a goal by 2030, we should not be recording new infections. So we trust that young people here in us today will take this information and let others also benefit from it.
I think one of the myths that is coming on in countries like ours is the fact that the services are only meant for young people. But couples also need the services of prevention, especially condom use, for a variety of purposes. You need to look at spacing your children. As colleagues, if you're a lecturer here working, you're staff, and you need to space your children. Otherwise, one of the things people don't understand the fact that you have the chance of your woman getting pregnant every year. Once a woman delivers, within 42 days, the womb is ready for another set of deliveries, to pick up another pregnancy. So the birth spacing is very useful as one of the practices. One of the things that are very efficient is the use of condom. But I will tell you, as you mentioned, you can use all the other, we're talking about PrEP, which is pre-exposure prophylaxis. But pre-exposure prophylaxis will only prevent you from HIV. It will not prevent you from STI.
Yeah.
So, but condom is able to prevent you for all of these in combination. Remember, she was emphasizing that condom does prevent you from HIV, from STI, and from pregnancy. So you can see how uniquely it stands in position.
Okay, so now you're in university, and this is mostly likely to happen in the university where students get involved into that. So do you bring the practical examples of what you are speaking about? Do you bring condoms to share with students, or are you here to do some HIV tests with the students and of course community members as well?
Let me have the
So one of the beauty of us being here today at Central is that we come in variety. We do not only bring condoms, but we bring condoms with style, with steez, with flavor. You understand? So we, like, this is a national call. So what happens is, at national level, every partner that has condom in the country pull out different brands. So here today we have condoms with banana flavor, strawberry, mint. I don't want to call. We are having a public lecture. Now, one of the things that we're going to do is to massively provide access to every student on this campus. And aside the public lecture, what we are going to do is to install a condom dispenser. Even after the International Condom Day, there will still be access to the condoms. We already have health workers that are working here at Mile 91 that will be connecting with the students' bodies and the administration to ensure that condoms are available. So we're providing condoms, and we are also demonstrating the use of condoms.
I like what she ended up on, because we know one of the problems that people say there are problems with condom use. But I'll tell you the real issue is they have gaps in terms of knowledge and the use of condom. Today we are coming with that unique skill back to the students so that you not only receive the condoms, but you are able to correctly use condom and to be able to appreciate the value while you're still using it.
I see my guys at the back of the camera, they are smiling as this is very important to them. Yes, it's very essential that you do not only pass on the message, but you give access to people to use them as well. So let us talk about your visit here in Mile 91. I meant to understand you are spending days with regards to the student body and of course the community people. So what do you have on Saturday?
So first of all, we are here for the International Condoms Day celebration. International Condom Day is a campaign that was established by AIDS Healthcare Foundation since 2009 with the goal of creating access to information around condom and general sexual and reproductive health. And it is stated to be around the 13th of February because of the activities that usually happen around Valentine. If I could ask you now, a lot of people will say this is a day to share love, to show that you love this person. And for our young people, it's a day that they lose their virginity. It's the day that they don't even have the willpower to negotiate sex. So for them, it's a day for them to go and get money to do their hair or buy whatever flowers or any gift. Because they are in that, I would say, state, where they are vulnerable, it becomes difficult to prevent even them from having sex on that day. So ICD, which falls on the 13th of February, it's like a way of giving out pre-information so that young people know that the sex they're looking for now is not the future. There is so much that you have to do. And besides, if you go and have sex as a way of showing love to this person, and then you get HIV at the end of the day, or you get syphilis, gonorrhea, hepatitis, or you even become pregnant, it becomes difficult for you. Some people even say, okay, it's better I get pregnant. Pregnancy is just 9 months, but with HIV is for life. We've stated that there is no absolute cure at the moment that we're speaking here. So meaning if you have HIV today, you have to be on that medication for life. It's going to cost you. It's also going to cost the government because the government is spending more money in providing all those essential services. And of course, we know prevention is better than cure. So that's like the essence of us being here. And part of how we are going to celebrate this International Condom Day is what we will start today to have the symposium or the public lecture with the students. Let them also hear firsthand these informations that we have, practical sessions, and we also give opportunities for question and answer and numbers for further questions and access to services. But aside the symposium, there's a football match because we understand that in this part of the country, football is one of the things that brings people together, especially young people. So there's going to be a football match, and interestingly, this university is going to play against the host of schools in Mile 91. I've been told that you have players, but I wonder if you're going to win that game. That's up to you. The bike riders, together with the business people, are also going to play the police and the military. So it's going to be a host of games that we are going to play today. Okay, so and the winners will actually get their award during, there's a condom festival tomorrow on Saturday at the main lobby park. So every partner, if I aside down condom, you will have access to even family planning, whatever services that you need, will be there.
Okay. Just in addition to that, you will notice that in reaching the university, we targeted having bringing condom and having this public lecture.
I hope you have some with you here that you'll be giving us in this video.
Yes. Just when we live here together with the demonstration. Why are we doing this? It's a right issue. Remember, we're doing it within the ambit of the law. And one of the requirements of the law is that people who are below 18 are not to be exposed to sex. If they do, if you get a sex relationship with a child under 18, it's called a minor. It becomes a legal issue for prosecution. We know there is a law Registration of Offences Act of 2012 that was also repealed, and 2019, the 2019 one, it gives penalty for people if you have two people under 18 and people on 25 and above. But we targeted university because we know that everyone that is here, the education requires that you may have met the minimum threshold, you're likely to be within 18 and above. So having you exposed to sex education, demonstration of conduct is a right that you should have, it's a right issue. So it is part of your reproductive health right for you to know, but then it is something you owe the responsibility to manage. Remember what Esther was saying, our emphasis is that look, we don't want you to get pregnant, we don't want you to have STI, we don't want you to have HIV. And so it means that the burden of responsibility is on you, so it's a right issue. So that is why we're here, so that you're educated and you have access to the services. Thank you.
That is actually something I wanted to talk about. In as much as it is important for people to use them, you made mention of Valentine, young girls giving themselves as gifts to their boyfriends, which is actually not the case. In as much as it is important for us to be cognizant about that, but it is also essential that people below that age should not be part of the sexual intercourse as of now, because law-wise, constitutional-wise, it is there, and biblical-wise, it is also there. Thank you for making that very clear. So it's an advice for every young person out there that wants to give yourself out. It's Valentine. Oh, the only gift I can give to my boyfriend is by sleeping with him. That is not it. Yes. So thank you so very much. So lastly, before we go, you've explored Central University. You've seen different places. You walked around. What is your impression about Central University? Let me start with you.
For me, I think I have been in love with Central University. I actually came here 3 years ago and I met with the registrar. And I brought ideas about how they can look at short-term courses that will bring professionals together to be able to address gaps in the field of work. And I feel that today I was speaking with Bibura, one of the lecturers here. He told me that some of these had been instituted. I was very proud. And I was just appealing that they look at more opportunities, engaging institutions to look at short-term courses, maybe in areas of sexual reproductive health, maybe in the area of IT, maybe in the area of general computer knowledge, maybe in the area of financial systems, software tools. Because these are added advantages institutions are looking for, and I'm sure it will be useful. But I'm proud of the growth I've seen of the university and the wide variety of courses. I'm very proud, and I feel it's a learning context that one could take advantage of.
This is amazing. I feel like, I expected this question because I know somehow there's no way you will not talk about Central University. But anyway, Central University, I see it as a platform or a space for opportunities. Yesterday we had the opportunity to talk to the Chancellor, and it was so inspiring, having the knowledge about the sacrifices that were put in place to even start an initiative like this in this part of the country. That gives us a clear insight that everything is possible, and we can always, there are potentials. All we need as Sierra Leoneans is the space. And coming here with the quality and the setup that we've seen, we were able to go into the labs, the smart agriculture. It's just one word: impressive. Thank you to all those who were able to put this, and we hope that us Sierra Leoneans will be able to make very good use of this opportunity that has been given to us. Watch out, we are coming. Either as students, lecturers, whatever, we are coming.
Thank you. I definitely expect you here. So thank you so very much for being with us here today. So of course, viewers, this is where we'll deliver down the curtains for today's edition, and I have been your wonderful host, James Samuel Tholley. Till then, goodbye.